related to the clinical anatomy of the neck, along with explanations. 1. A patient presents with a midline neck mass that moves upward when swallowing. It is painless and located just below the hyoid bone. What is the most likely diagnosis? A. Thyroglossal duct cyst. B. Branchial cleft cyst. C. Cystic hygroma. D. Dermoid cyst. Correct answer A. Thyroglossal duct cyst. Key features: midline mass that moves with swallowing or tongue protrusion, remnant of thyroglossal duct, treatment, surgical excision, Sistrunk procedure. 2. A patient presents with a painless mass at the lateral neck along the anterior border of the sternocleidomastoid muscle. What is the most likely diagnosis? A. Thyroglossal duct cyst. B. Branchial cleft cyst. C. Cystic hygroma. D. Lipoma. B. Branchial cleft cyst. Key features: lateral neck mass anterior to sternocleidomastoid, remnant of branchial cleft, second cleft most common, can become infected and require surgical excision. 3. A newborn presents with a large, soft, compressible mass in the posterior triangle of the neck. The mass transilluminates. What is the most likely diagnosis? A. Lymphadenopathy. B. Branchial cleft cyst. C. Cystic hygroma. D. Thyroglossal duct cyst. Correct answer: cystic hygroma. Key features: soft cystic mass in the posterior triangle of the neck, transilluminates fluid-filled lymphatic malformation, associated with Turner syndrome and Down syndrome. 4. During a thyroidectomy, injury to which nerve would result in hoarseness? A. Hypoglossal nerve. B. Vagus nerve. C. Recurrent laryngeal nerve. Superior laryngeal nerve. Correct answer C. Recurrent laryngeal nerve. Key features: innervates all intrinsic muscles of the larynx except cricothyroid. Injury, hoarseness, or loss of voice. Commonly injured during thyroid surgery. 5. A patient with a deep neck infection develops swelling of the submandibular and sublingual spaces, causing elevation of the tongue and airway obstruction. What is the most likely diagnosis? A. Paratonsillar abscess. B. Ludwig's angina. C. Retropharyngeal abscess. D. Parapharyngeal abscess. Correct answer B. Ludwig's angina. Key features: rapidly spreading infection of the floor of the mouth. Common cause: dental infections, Streptococcus anaerobes. Can cause airway obstruction, requires immediate airway management. 6. A patient presents with neck pain and difficulty swallowing. CT scan reveals a collection of pus in the retropharyngeal space. What is the most likely complication if left untreated? A. Ludwig's angina. B. Mediastinitis. C. Paratonsillar abscess. D. Laryngeal edema. B. Mediastinitis. Key features: retropharyngeal infections can spread to the mediastinum. Life-threatening complication, requires immediate IV antibiotics and possible drainage. 7. A patient is unable to turn his head to the left and has difficulty shrugging his right shoulder. Which nerve is most likely injured? A. Hypoglossal nerve. B. Vagus nerve. C. Spinal accessory nerve. D. Recurrent laryngeal nerve. Correct answer C. Spinal accessory nerve. Key features: innervates sternocleidomastoid and trapezius. SCM turns head to the opposite side. Trapezius elevates the shoulder. Common injury during lymph node dissection or neck surgery. 8. A patient with suspected carotid artery stenosis is scheduled for a carotid endarterectomy. Which structure is at risk of injury during this procedure? A. Hypoglossal nerve. B. Glossopharyngeal nerve. C. Vagus nerve. D. Recurrent laryngeal nerve. Correct answer C. Vagus nerve. Key features: carotid artery surgery can damage the vagus nerve, hoarseness. Also at risk, hypoglossal nerve, tongue deviation. 9. A patient presents with difficulty swallowing, a hoarse voice, and an absent gag reflex. A lesion affecting which cranial nerve is the most likely cause? A. Hypoglossal nerve. B. Glossopharyngeal nerve. CNIX. C. Facial nerve. D. Trigeminal nerve. Correct answer B. Glossopharyngeal nerve. Key features: loss of gag reflex, afferent limb, difficulty swallowing, pharyngeal muscle weakness. Lesions can affect both CNIX and CN10. A patient is diagnosed with Eagle syndrome, which is caused by elongation of which anatomical structure? A. Hyoid bone. B. Thyroid cartilage. C. Styloid process. D. Cricoid cartilage. Correct answer, C. Styloid process. Key features: elongated styloid process, compression of nearby nerves. Symptoms: throat pain, difficulty swallowing, and referred ear pain. Can be treated surgically if final thoughts. These questions cover